Hello, this is Dr. Janet Nalbandian here at Avante Medical Center, and today I would like to talk to you about how to properly collect the 24-hour urine hormone test. It's called a Rhein test. First thing I'd like to do is I'd like to go through the test kit to introduce you to all the materials within the test kit itself. So let's go ahead and open this up. Of course, since this is a 24-hour urine test, we have a jug here that you're going to collect all urine in a 24-hour period. We have our lab requisition here. Let me pull this out. It's in an envelope. It will have the test requisition itself, of which your name and address and all the proper information will be filled out. Also, your doctor's name should also be checked off on the test, and the proper test checked off by your doctor. On the front of the requisition, it's very important to remember also this is where you're going to record time and urine volume, and we'll go back over that again. So I'll set that aside. Instructions come with the kit. It's very, very important that you always read the instructions prior to starting any test. And we'll review the do's and don'ts. There are certain restrictions that you need to be aware of and things that you need to understand prior to collecting a proper 24-hour urine. Also within the kit is a styrofoam box. This is actually what you're going to mail off. This contains within it, and I'll open it up in a few minutes, this contains the actual collection cup that you're going to use to mail off, because of course you're not going to mail a full 24-hour jug off to anybody. And last but not least is your bag for mailing off the test kit. This goes to UPS. This also comes with a shipping receipt all ready to go. You'll put your name and your address on it. So when everything is done, you're going to put everything back in the shipping package and drop it off at a UPS, or you're actually going to have UPS pick this up. So let's go ahead and talk about this test a little bit. Okay. First and foremost, there's a few things that you have to understand prior to doing a 24-hour urine test. And these are instructions that you need to discuss with your provider prior to starting to the test. Many of the providers will give you a sheet that will tell you what to take or what to stop 24 hours prior to the test and what not to be taking on the day of the test. There's a few things that you need to understand. So when you read through the instructions, and number one is going to talk about what you actually need to avoid. They ask you to avoid alcoholic beverages. They say no more than 1 to 2 drinks 24 hours prior to starting the test itself. Also, they talk about hormone replacement, and this is really important to understand. And that's what this sheet that's been filled out by your provider is going to help you understand. Many of the providers would like you to stop taking your hormones prior to the test, especially those hormones that you're taking by mouth and any type of hormone that you're inserting vaginally, because this will interfere with the test. So again, refer back onto the sheet that your provider gives you that tells you what to do and what not to do on the day 24 hours prior to the test and on the day of the test also. One thing you do need to understand is if you're taking multivitamins, many of the multivitamins have B vitamins in them. And so stop taking your multivitamin or any supplements 24 hours prior to the test itself and on the day of the test, because the color of the vitamins will interfere with the actual measurement. If you're a female who's actually menstruating on the for the Rhein test, the instructions tell you that you're not to start your collection until day 19, 20, or 21 of the day of the test. So again, note the first day of your menstrual period, count on out to 19, 20, or 21. Those are the days that you're actually going to collect the urine. For postmenopausal women who are not menstruating, it doesn't matter what day you choose, as long as you choose a day of which you'll be home to collect 24 hours of urine. Let's talk about how to collect this urine. You need to be home. You're not going to be traveling, you're not going to be out and about, because volume of the urine is very important here. You want to be home. So every time you urinate, you're going to have to collect that specimen, and you're going to pour it into this jug. So how do we start? So on the day of your urine collection, Most people start this in the morning, and I'll give you an example. Let's say you start this on a weekend. Most people work during the weekday, so they don't do this test. Let's say you get up on Saturday morning and you get up at 8 o'clock in the morning. We all wake up with full bladders. The very first urine, the start time that you're going to put down on this sheet, which is going to be 8 o'clock, if that's your start time, you're going to void, but you're not going to collect the first urine. You're going to go ahead and void into the toilet, and this specimen, the very first specimen, is not collected. And the reasoning for this is you want to start on an empty bladder. So 0 hour or start time is an empty bladder. You completely empty your bladder out. Now, from that 8 o'clock time, let's say Saturday morning, until Sunday the next day, that'll be full 24 hours, you're going to collect every bit of urine that your body produces in that 24-hour time, including urine. If you get up and urinate in the middle of the night, you're going to have to collect that specimen. One thing I'd like to mention, and it talks about it here in the instructions, please do not change the amount of volume that you typically drink throughout a day. Okay, do not increase the amount of water or fluids that you take, and don't decrease the amount of water or fluids that you're going to drink. Drink your normal amount of fluid that you would in any given day. So you get up in the morning, 8 o'clock, you void, you get rid of the first specimen, and from 8 o'clock in the morning until 8 o'clock the next morning, Saturday to Sunday, if that's your time, you're going to collect all your urine and you're going to pour it into this container. Now, there's a couple ways to collect urine, and I'm going to show you something here. The lab might give you a urine collector. Sorry, I went down for a minute. This might help you collect urine. You can put this right on the toilet. You can use this throughout the full 24-hour collection. You can set this right on the toilet, so when you urinate, you're just going to pour it into the container every time you urinate. I'll set this aside here. Once you're through collecting urine, after each urine collection, you can put this back in a cool place. You don't want to leave this sitting out. Refrigerator works just fine. At the end of the 24-hour period, and again, I'll go back to the example of Saturday to Sunday. When you get up Sunday morning, you're going to collect that morning specimen. And just think of it this way. You want all the urine that your bladder collected while you were sleeping. So last specimen is collected, you pour it into the container. Now you're ready to go ahead and measure. So go ahead and look on the 24-hour container, and I'll scoot right over here. And this is in milliliters, and this is in 25 milliliter increments. Most people urinate between 2,000 and 3,000 milliliters of urine in a 24-hour period. Go ahead and best estimate where the urine falls at, and please record that on that lab requisition. Again, it has right here the total volume in 24-hour period. So if it was 2,325 milliliters, go ahead and record that down. Now, of course, you're not going to mail this jug out, so I told you I would open up this styrofoam box. So we'll peel this down. Don't rip it, because you're going to use it to seal it back up. So bring it up. I'm going to open this up for you. Inside this styrofoam container is the tube you're going to actually pour your urine specimen in, a bag to put it into, and we have a cold pack, because when you mail this off, you have to send the urine frozen. So shake up the jug, make sure it's well mixed. You're going to open this up, and if you look on the tube, and it'll tell you in the instructions that you want only 45 milliliters. Now, I'd like to tell you this. Don't go above that 45 millimeter mark, because if you take it all the way up to the top, you put the lid back on and then you freeze it, fluid expands and you might pop the lid off of it. So only 45 milliliters. So go ahead and pour your aliquot into your tube. Please put your name, the date that you did this on. You're going to take the cold pack and the urine itself, and you're going to stick this in your refrigerator until it freezes. So you have to send the specimen out frozen. Frozen pack, frozen urine. So go ahead and put the urine back in the plastic. It's frozen now. You're going to put the cold pack on top of it. You're going to go ahead and close the box back up. You're going to seal. You're all done with this. Pour the rest of the urine out. Chuck the urine container. You don't need these anymore. And we're ready to ship. Make sure that you have your lab requisition. You've noted the date of collection, the time you started, the time you finished, and you've put your total volume down of urine. Also, you should have a page, excuse me if I open this up, that will also have the cost of the urine, the test, so of course you know what test you're running. For the Rhein test itself, it's $225, and of course you're going to pay for shipping. So this lab again requires prepayment, so either by check or credit card. You're going to include that in your payment, so you're going to put both the payment schedule and the lab requisition back in the envelope here. The lab, the box and the lab requisition are going to go into the packet, seal the packet up, fill out the shipping label. Go and put the shipping label on the UPS package, and either you can go to a UPS office or you can have somebody come in and pick it up for you. One thing I would like to mention about when you ship this, because the lab needs to one thing I need to tell you about the shipping is that the lab needs to receive this within 24 hours of shipping, and the specimen has to be frozen. So you can only ship your urine specimen and the whole packaging Monday through Thursday. You cannot ship this on a Friday or a Saturday because you don't want this to sit in a holding area for 24 hours. So again, let me go ahead and state that again. So when you actually mail this off, you can only mail it Monday through Thursday. The specimen gets there in 24 hours, and it has to get to the lab in 24 hours. They are not open on Friday and Saturday, so it'll end up sitting at UPS shipping, and it'll thaw, and the specimen will not be any good. Now, of course, if you have any questions or concerns, you can give us a call here at Avante Medical Center, and we would love to answer your questions. If you have any questions, give a call.